Oh, did I miss somebody? Ray Nadler Olick, I'm sorry. And then Jennifer Lucas is not there. I apologize.
Recently, the FDA sent a warning letter to a supplier of fluoride supplements, ordering them to cease and desist from manufacture or distribution of that product line. The FDA letter categorizes fluoride supplements as unapproved prescription drugs, not generally regarded as safe and effective. Why should this matter? It matters because Austin's annual water quality report mailed to consumers includes what amounts to an endorsement of such supplements for infants as young as 6 months. The Austin Water Utility website carries the same irresponsible plug. It occurs within the context of what's supposedly a warning against mixing baby formula with fluoridated tap water to avoid dental fluorosis, but it, in reality, reads more like a fluoride promo because it plants the idea that anyone who dares deprive their infant of fluoride for any reason may have done them a harm requiring early medical intervention. Here's the wording. If you use only non-fluoridated water, such as purified, deionized, or distilled water to prepare your baby's formula, your doctor may recommend fluoride supplements beginning at 6 months. However, next slide, please. The FDA in its letter makes plain that ingestible fluorinated medications are not to be prescribed for children under 3 years of age. Even Dr. Wong, who grafted the sentence in question onto CDC language, admits it's based on recommendations drafted by 3 trade organizations whose members make money from prescribing supplements. Clip, please.
However, some children may develop enamel fluorosis, a cosmetic condition. And then also, in terms of the recommendations for dietary fluoride supplement and to discuss with your physician, approved by the American Dental Association, American Academy of Pediatrics, and American Academy of Pediatric Dentistry.
Okay, the FDA trumps anything these private groups have to say. Austin Water's website and water quality report language in regard to supplements is unacceptable. Now is a perfect time to drop the tacit support of discredited fluoride-containing drugs for babies. And we've handed out all the relevant information documents and entered them into the records. Are there any questions or comments?
Thank you very much. Yes, Mr. Zimmerman?
Before you go, so it was San Marcos that there was a referendum in San Marcos, and it was 60% or so that wanted to ban the addition of fluoride. And so, do you know, in the ensuing years, presumably there'll be some statistical data collected in a city that doesn't have fluoride that can be compared to cities that do have fluoride. So, do you have any idea how long that will take to get that data back? So we can kind of have a comparison group.
Well, in the first place, you have to be sure that that comparison is actually being made, that somebody has to do that study. If they did that study, I would think you would start to see some kind of results, and maybe, I'm guessing as a layperson, 5 years maybe, as little kids grow up and start sprouting
right, but
teeth.
the FDA, Food and Drug Administration, right, Centers for Disease Control, these are the kind of things they ought to be looking at, right, in the years ahead.
They ought to be,
Yeah,
but
okay.
they won't.
How was our language developed?
And actually, I'll say it's off the CDC statements in the website. For instance, on the CDC website, it says water fluoridation is safe, effective, and healthy. Water fluoridated at a level optimal for oral health poses no known health risks for infants. However, some children may develop enamel fluorosis, a cosmetic condition. And then also, in terms of the recommendations for dietary fluoride supplement and to discuss with your physician. Approved by the American Dental Association, American Academy of Pediatrics, American Academy of Pediatric Dentists.